never know with Carl, and I'm really relieved, thank you, Carl, that that group was like, this is nice. I like this kind of a group. It's easier to talk to, and I can see all your lovely faces, so it's really nice. Again, my name is Paul Sanchez-Hindi. I was born and raised out in Grants. My dad was a miner, and my mom was the warden of the women's prison out there. So my mom came home and she put the gun on the shelf and her badge, and I was scared to death of her most of the time, but she was really sweet. That badge came off. I started in healthcare, just so you know. Oh, and thank you for dinner. I really appreciate that. Appreciate all the carbs. If I fall asleep, it's my fault. But I wanted to, I didn't, you know, your careers find you. This happens often, right? So healthcare found me. I didn't expect to be in healthcare. I was 19 and kind of floundering, couldn't decide what I wanted to do in college. And someone said, you should go apply at the Cibola General. That was the county hospital out there in Grants. And so I met some really interesting people out there, went in and interviewed, and they asked me, and I'm not kidding you when I tell you this, at 19 years of age, if I would bill their Medicare and their Medicaid claims for them. And I said, what? And they were like, no, we're going to get someone to train you, and then this is what's going to go down. And so for about the first 6 months, I learned about accounts receivable. Do you remember when we used to have the big binders of accounts receivable, flipping through the pages? It was all done on paper. Learned all that. Had some great mentors out there. Learned about all the forms and the billing, the HICFA, the UB40s, all that. And then when the payments would come in and how to post all that, that's kind of how I got started. And then I saw that all the fun was happening on the clinical side. And I was like, oh, that's really cool. I want to know more about that. And so I spoke with one of the lab managers out there. And these were like die-hard, the whole group of women that were running the hospital, and I do mean that. Doctors, you know, the nurses are the ones running the hospital. Let's be clear. Okay, that's just how it goes in healthcare. The nurses run the show. The doctors, of course, we're so grateful for, and they, like me, have learned to take direction well in healthcare. And so they're gifted, and we're lucky to have them, but that's how things went. And all my mentors along the way have been really strong women. I've been really lucky with that. So I had I was there at Cibola, then I went to work in the lab with some really strong people. And then Dorcas Yates, she would crack the whip. And she was this tough, holiness Pentecostal nurse. And I was scared to death of her. Like, you couldn't even move but her, just because she was just this presence. And so, but it was a wonderful opportunity for me to learn healthcare in a county facility under someone like that. And the reason was because it's dotting your I's and crossing your T's. And progress notes, you note everything because you don't know what risk a county hospital is going to come up against. And so you have to pay attention to the risk. That has followed me my entire career, that message of managing risk. And so I've had, you know, the opportunity to work in those types of, that type of environment my whole entire life. From Cibola, I went to Rehoboth, and worked with Herb Mosier out there. Barbara McAllister at Loveless, not long after that. I wanted to move to Albuquerque and do some things that were different. And then after Healthcare, I took a stint to learn to get durable medical equipment. I worked there for a year. And Presbyterian Healthcare Services, where Mary Eden hired me. Courtney, our chief of police, his wife, hired me at Presbyterian. I was done in the ER. And they were doing the Salud rollout, the Medicaid rollout. I'm dating myself a little bit, but that's how long ago it was. And so she hired me, and I learned all that at Presbyterian, and wound up in provider services being a contract specialist for them. And so once I kind of got that under my belt, I was managing a number of contracts across the state, hospital contracts, the contract with Dr. McEnany there at the Cancer Center, who's my boss, Barbara McEnany, and she's amazing. And then we used to fight all the time. Dr. McEnany is just like another imposing figure in the community, right? She knows as much as she possibly can about oncology and takes care of patients across the state with a group of physicians there at the Mexico Cancer Center where I am now employed. And I'm so proud to work there. My head was spinning at Presbyterian. I learned so much there, but there was a lot of information and the information was leaking out over my ears. And I thought, you know what? I have had a number of family members who have been impacted by cancer, and I want to know more about oncology. And so I want to kind of pare it down. And so I thought I would go work in oncology and it would pare down, and that's not what happened at all. As a matter of fact, there's a lot of things you need to learn when you're working in oncology. And so, and it's pretty unbelievable. These doctors are brilliant, the nurses are brilliant, and so I want to tell you a little bit about that. Personally, I want to tell you my family, on my mom's side, just real quick, my mom is Navajo, my dad is Spanish. And so I have a wild side to my personality, but that kind of has helped sustain me through the many years I've worked in healthcare. And I do, again, appreciate you having me here. We're going to kind of go through these, and I kind of want you to see how we measure providing quality cancer care with these directed virtues of love, kindness, compassion, and trust. And you think that they talk about these things in the media more, but it happens every single day. Wouldn't you agree? I mean, you can't do cancer treatment without these virtues every single day. You have to pay attention to it. And you want to make sure that your staff, your physicians, and everybody's trained appropriately as far as the details of their job, but it has to come from the heart. You cannot treat cancer without it coming from the heart at some point. And so we're going to go through these. I'm going to tell you a little bit about quality measurements. So healthcare is in the media ad nauseum. I think we're all over it. I mean, we hear about it all the time. We heard about it through the Affordable Care Act and what was happening with Obamacare, something he has actually taken a liking to now. But was it meant to do everything that it needs to do for our country? Absolutely not. As a matter of fact, as far as I'm concerned, and don't tell my Democratic friends this, but I sound more like a Republican when I start to talk about healthcare and Obamacare. I think that one of the biggest misses with Obamacare was that it didn't discuss tort reform and risk, again, for physicians. And that's really disappointing to me, because I'm in the business of making sure that I take care of the doctors at the Mexico Cancer Center and the patients. And we have to be able to manage that. And as far as Obamacare is concerned, I'm a little saddened that that didn't address that. And I think hopefully as we move on with these new initiatives that we're able to address some of that concern. So, the list of standards. Quality healthcare, the topic of the century. Going into business, I'm going to do that. I'm going to go into business and just create healthcare acronyms. These are the measurements, and I'm not kidding you. NCQA, HEDIS, PQRI, PQRS, COPE, JCO. I mean, it just goes on and on and on. These standards for quality that they want us to encompass in the work that we do every single day. And it's not easy. And a lot of them are hospital standards, a lot of them are private practice standards, lab standards, radiology standards. I mean, it just goes on and on. And when you work in an oncology group like we do, we have many different things that we're trying to do there at the cancer center. The doctors, excuse me, they had one goal when they created the cancer center, and we have 4 clinics across the state. We have Las Cruces, Silver City, where we partner with Gila Regional Medical Center, and we have Gallup, where we partner with 2 healthcare centers out there, GIMC, which is the Indian Medical Center, and Rehoboth McKinley, and then we have the clinic here at Lang. And we are trying to manage the quality measures and making sure our physicians and our staff and the patients are all taken care of, managing risk at all 4 of those clinics, utilizing as many of these measures as we can regarding quality. Can you imagine doing that every single day? It's a no wonder I'm babbling half the time when I'm wandering around the clinic. At least that's what my assistant tells me. So anyway, in quality measures, there are, if you think about breast cancer, GI cancers, wherever, there's 16 primary site cancers, and they all have their own quality measurements. And we have to keep track of these for the government, for the Center for Medicaid and Medicare Services. So how do you know in tracking all these quality measures that you're doing the right thing? Well, I think that we have a general idea. Number one, we had to do like everybody else. We had to implement an electronic medical record system, an electronic health record. We have to have HIT people and technology people managing all the medical records for our patients. I mean, it just goes on and on and on. Do all these measures translate to quality outcomes for your patients? No.